what motivates me is providing the best equipment for patient care in our current day and age. So I know that whatever we can do to provide easier access to equipment, easier user functionality to the equipment for the clinicians, those are the kind of driving forces that keep me going, because I know at the end of the day, it's about our patient care. And especially as we look at the world today, and we see countries struggling to keep up as far as equipment goes, that hits my realm pretty hard, making sure that there's access to equipment, access to parts, that we have those spare parts at hand, that I'm not missing spare parts that I thought I had in my shelves. And that leads me into kind of what keeps me up at night, that UpKeep has really helped solve, is making sure that my inventory doesn't get lost, stolen, misplaced. If I buy 10 hoses and all of a sudden I have 0 hoses when I thought I had 10, those kind of things would really bother me, where I was doing monthly or every other month inventories with the old system, and I don't have to do that anymore. And I can see real-time costs onto my asset. So if we spend $1,000 repairing an asset, I can see that in real time, because those questions come about in these kind of times where, do we have this equipment? Where is this equipment at? How do we get more equipment? And those things are what really keep me up. My organization has been very proactive in establishing kind of a realm of control during this outbreak. We're in a very rural community, so most of my stuff is about 2 weeks away. I don't have access to overnight a whole lot of parts unless I spend a whole lot of money, just because of our rural aspect of where we're at. Like I said, we're about 4 hours away from Denver, about 4.5 hours away from Salt Lake City, and so we really don't have that immediate access to parts. So using that inventory where I can real-time track and keep that inventory at a reasonable level for where we are has been great. I've established that prior to this event happening. And now we can look at, okay, we have this many ventilators. This is where we can get access to more ventilators. This is what we have on site. So if I have a director come in and ask me, how many IV pumps do we have? I don't have to sit and search for those answers. I can pull those answers up quickly and have documentation for him, because usually they're like, okay, you told me the number. Where's the documentation to support that? And I can show that to them on UpKeep. And that has been really helpful as we gear up, because we have not had any cases yet, but we know it's around the corner. So we are just kind of in that gear up process right now, and software has been instrumental already during this situation. You know, and the biggest thing for us that you can do for us right now is keep your software up and running for us. You know, we're a 24-hour access, so you guys keep doing what you're doing, make it available for us, and we will be great. And please realize this too, for you and your team, you are also helping supporting patient care with your software. Please understand that you are also on those front lines, because we need your software to make sure that we can mitigate issues prior to them becoming fires. And that has been great, and that's exactly what a CMMS is supposed to do, is help us mitigate the issues that are going to arise.